According to Massachusetts Governor Charlie Baker, we are currently in the middle of the expected surge of COVID-19 cases, which can bring a lot of anxiety to people who have been doing their best to maintain social distance. In addition to anxiety, some may feel isolated and depressed. I spoke with Elaine Burgess, the clinic director of the Best Life Emotional Health and Wellness Center, run by the Mental Health Association, to find out more about the potential risks.
So, Best Life, we're an outpatient behavioral health and wellness program, and we offer individualized counseling services to anybody ages 5 or up who may be currently experiencing any type of a mental health, substance use, and or co-occurring problem. So these could be people who are just, have something that's on the more severe level, or it could be somebody who's just struggling with your just normal everyday life circumstances. And currently, right now, with everything with the COVID 19, we have, as of 2 weeks ago, moved to providing telewell services. So we have the unique opportunity that we can continue to still meet with individuals for therapy, whether it be through the teleconferencing application. LifeSize is what we use, which is very similar to Zoom or FaceTime or Skype. And for folks who don't have the technology or find that they live in areas that they have very spotty Wi Fi or it's not working, we are also able to offer the telephone services to individuals as well.
How important is that to maintain that line of communication and that therapy going as people are dealing with different issues?
Yeah, so we're finding it's almost paramount, very, very highly important that people are staying connected to their therapists, honestly, now more than ever. Because as we know, a lot of what's happening with this COVID 19 is there's so much stuff that we're always seeing and we're hearing about that it can actually increase and promote a lot of people's anxieties, fears. And some people even can tend to isolate more now than they did before. And there's also individuals as well, who may be at risk if they have a substance use disorder. They may actually be at a higher risk of relapsing due to the amount of isolation that we're all unfortunately being faced with at this current time and day of our age.
So let's talk a little bit about that. Somebody who is in recovery and who has made great strides. Now you have this situation where you're home, where you're in, the same location every day, all day, and you are isolated. There's also that element of anxiety on top of it. For somebody who maybe was able to quit drinking, how do you advise them?
So I say, keep doing the best that we can to keep our routines as close to possible as we were before this whole new normal, as they're calling it, took place. Um, Something that's very important is that folks don't isolate. And I think what's important to note is there's a very big distinction between social isolation and social distancing. So, social distancing basically is that we're just, if we're out in public, although we want to try to minimize right now from what we're being advised through the Governor Baker, is not spend so much time outside and being around other people, and if we have to be out, to utilize that 6 foot distance. The social isolation doesn't have to stop. What we're finding is it's just really empowering people to find those just very creative, unique opportunities to stay socially connected with others. So for somebody who's in recovery, it's very important that they continue to reach out to their sponsor, that they continue to utilize meetings that are being held online. You can go to the internet, and there's lots of different sources out there where there's AA, NA, Smart Recovery, a whole slither of different opportunities that people can still stay connected and should still be staying connected with anybody who is part of the recovery path.
So you also have people that you help with, as well as with different addiction, let's say nicotine, for example. You mentioned anxiety, reaching for the cigarette or whatever it might be. Perhaps it's somebody who eats, just out of emotional eating. Again, being home, being out of that routine can really be a trigger. How do you help people who are dealing with that?
I think, when we're home, a lot of the things that happen when we're home all the time is we get bored. And a lot of times, boredom can then lead to engaging in things that we wouldn't necessarily be doing if we were distracted, such as being out at work, or, if somebody's out doing other things with their daily life and their daily routine. So, kind of bringing it back to that, still continuing to do the things that you would normally do if we weren't in this crisis. So, for as an example, somebody who is working, to get up, get dressed as if you're going to work that day, pack your lunch. A lot of times, folks are, very conscientious if they're packing a lunch for the day that they're trying to pack healthier items. So, kind of trying to still do some of those same routines that somebody was doing before and finding ways to take breaks and having an outlet. So, if you're home and you're noticing that you're getting antsy, the boredom is really kicking in, get up and move. A lot of people I've been talking with have said, they found this is a really great time for them, that they've been able to get some spring projects done. They've been able to clean up their garage or their basement or other areas of the home. There's other people that have said, what they're really finding is that they're making it a point to get outside every single day and take a safe walk around their neighborhood. And again, modifying and maintaining that 6 foot social distance, but that they're still living their lives. And other individuals have spoken about taking online courses or engaging in a new activity or hobby of something that they hadn't done before, but they've seen something sitting around their house, like a musical instrument. So one person I'm working with was talking about how, she saw it belonged to another family member. She said, "Well, why not? Let me learn how to play this musical instrument." So she's taken this time to Google some stuff online and to self-teach herself this musical instrument. So I think there's still a multitude of things that people can do, but it's just acknowledging, that when you're having that feeling and you're having that moment, before you turn to that substance to make yourself feel better, whether it's that cigarette, whether it's overeating those sugary foods or those carbohydrates, or if it's an alcoholic beverage, it's just being mindful to pull yourself back and then doing something to allow yourself that time to distract.
Some people have talked about just additional problems that could arise out of this time period. People who might not have had any sort of issue with anxiety or any sort of depression might develop that as the days and weeks go on. How can you encourage people to really try to get that, set that goal or have that routine going?
It's almost impossible, I think, that this isn't going to impact anybody. So as you're saying, for individuals who may not have had anxiety or haven't experienced that, I think the way that things have transitioned so quickly and so fast, and how we've had to adapt to a completely new way of living, ways that I don't think any one of us really ever could have seen coming or really could ever have planned for. um, we're learning, I think, day by day, what is it like where we can take that step back right now, really pull into our inner strengths and really refocus and live our lives differently. And depending on the supports that individuals may have, if, they have somebody that they're living with and there's a family unit, this can be a great time to bring out those dusty board games, that have been hanging in our closets for years on end that we've never pulled out. It could be time to find some things around the house and be creative, do some crafts. I've spoken with a lot of my friends who are sharing with me they're actually making masks in efforts to be able to help others. So that's something that they're doing that they feel as if though they can be productive with society. But it's just really being in tune to yourself. We know ourselves better than anybody else does. So just to be able to acknowledge what we're feeling, validate that this is absolutely normal that we're feeling this way, and be able to find a way to release that. So whether it's through an active activity or if it's through being able to continue our community connections with other people.
You mentioned friends of yours who are making masks. I know that there are a lot of efforts across the community, people putting hearts in their windows, hearts for
Yeah.
healthcare workers, and thinking about paramedics and first responders. I mean, this is a different crisis in that people really can't go out and help and volunteer and go to a soup kitchen or anything like that. But those acts of reaching out to other people, is that a way to kind of distract yourself as well, from the blues that people might be having?
I find that it still provides a sense of community. It still allows people to feel empowered, that even though, as you said, you're right, we can't maybe be out on the front line sometimes the way the other folks are, we can still show our acknowledgement of them. We can still show our appreciation. And When communities get together and they do really significant things, I was talking with somebody who was sharing with me that somebody that we work with in the town she lives at, every single night at 8 o'clock, people from her town will go outside and they'll ring a bell for 1 minute. And it's just like that way of saying, we're here, we're not alone, we're all in this together. So it is providing that spirit of connectiveness. And it is providing, the ways that we can tell people, we understand, we're here for you, we thank you, we appreciate you. So I think anything that somebody can do to be helpful to other people, especially during this time when we can't be, going out of our houses the way that we normally do, anything that somebody has the opportunity to do, it's a wonderful thing.